Hi, I'm Nic Brown, pain specialist physiotherapist, and welcome to my YouTube channel. Today I'm going to be talking about the menopause, pain and musculoskeletal health and what you can do to feel your best during this time. We'll go through why menopause causes problems to our bones, muscles, tendons, joints, the best exercises to be doing, nutrition and other lifestyle tips. This is a big topic though, so the following is a summary of the key points and is not exhaustive. Remember, this video is for general information only and not intended as individual medical advice. When I talk about menopause, I'm referring to the entire transition from the lead-up phase known as perimenopause to the years that follow, called postmenopause. And if you're struggling with joint pain, stiffness, muscle loss, or more general pain, then you're not alone. A lot of the symptoms are due to declining oestrogen, which is more than just a reproductive hormone. But the good news is there is lots you can do to support your body. Oestrogen helps maintain bone density, muscle, tendon strength and joint health, and as levels drop there's an increased risk of things like osteoporosis or muscle loss, also called sarcopenia, joint pain and pain in general. Other common symptoms include the hot flushes, fatigue, brain fog, palpitations, reduced quality of sleep and weight gain. And unfortunately, you don't have to have any symptoms of bone loss until you fall and sustain a fracture, often the hip, spine or wrist, unless you are tested for it with a DEXA scan that your doctor can organise. It's usually requested if you're over 65 or under if you have a strong family history of risk factors such as steroid use, being underweight, early menopause without HRT or other medical conditions. Your GP would go through a risk tool to see if one is required. Let's go a bit deeper now to understand, why this declining oestrogen can lead to all these changes. Oestrogen plays a key role in maintaining bone density because it regulates bone remodelling. Oestrogen suppresses bone breakdown, keeping it in balance with bone formation. It has anti-inflammatory effects that can protect bone tissue, and it also helps the body absorb calcium from food and promotes vitamin D activation. So without it, calcium absorption decreases, increasing the bone thinning. Oestrogen plays a vital role in muscle strength and repair. It supports the making of these muscle proteins and regulates the way that muscles build new proteins, keeping them strong. It also boosts mitochondria function, which are the energy powerhouses of cells, ensuring efficient energy use in the muscles. And with lower oestrogen, muscles recover more slowly after exercise or injury. Women can lose up to 8% of muscle mass per decade after menopause, so it's important that we address this. Declining oestrogen affects our joints through reduced collagen production, which is the protein that keeps the cartilage, tendons and ligaments strong and flexible. Oestrogen promotes the production of the fluid which surrounds the joints, the synovial fluid, and that lubricates each of the joints. Without oestrogen, the body produces more pro-inflammatory chemicals that contribute to joint stiffness and more pain. So I often see women with stiff, achy joints, often one or more, tendon issues like at the Achilles, or things like plantar fasciitis. Other menopausal changes that are contributing, aside from the oestrogen, also include testosterone and growth hormone. These decline. And these hormones also support muscle repair and strength, and their reduction can contribute to things like muscle loss. We get a cortisol increase, which is our stress hormone. And then chronic stress combined with poor sleep during menopause raises the cortisol, which promotes muscle breakdown and more inflammation. We also get a change in insulin sensitivity, which can make it harder for the body to use glucose efficiently, leading to fatigue, muscle weakness, or increased fat storage in the body. Menopause can also significantly impact pain processing due to hormonal changes, as oestrogen plays a key role in modulating pain perception and inflammation. So its reduction can lead to an increased sensitivity to pain. This can impact conditions like headaches, joint pain and muscle pain. It can be more intense, or it can lead to a worsening of chronic pain conditions like fibromyalgia, osteoarthritis, migraines, chronic back or joint pain. Menopause is linked to poorer sleep quality, higher rates of anxiety and depression, all of these things which can amplify pain perception and also levels of fatigue. So the good news now is that there are strategies that can work on all of the above mechanisms that can help with the various symptoms. So let's focus now on what you can do to help yourself. So I'm going to start with strength training. This is important for maintaining muscle mass, joint support and bone health through the pulling action of the muscles that it creates on the bone. The key is to start slow and progress over time. You can start with things like bodyweight exercises like a squat or a press up. You can even do those against the wall. You can bring in resistance bands, which I'm a big fan of. Or you can go to the gym and do strength-based work with equipment or the machines. Aim for around 2 sessions per week, and depending on your symptoms, focusing on lifting heavier weights with lower repetitions, perhaps more like 6 to 8, and then doing a few sets of each. A stretching routine can also help with joint and muscle stiffness. And something like yoga or Tai Chi also incorporates the balance work, which is really great for preventing future falls. Cardio is also really important for many reasons. It reduces our risk of heart disease, improves mood, sleep and energy. And it could be as simple as a walking programme, which is also weight bearing, which helps with bone health. But it could also be things like cycling, swimming, anything that gets your heart rate up for a more sustained period of time. The guidelines say around 150 minutes of moderate intensity a week, but if that sounds high and you're struggling with pain, then go back to my video on how to exercise when you live with pain, as really anything you're able to do will all still help. If we move now to diet and nutrition, ensuring adequate protein intake to support muscle repair, especially key if you eat little or no meat, so you'll need to find some plant-based alternatives like beans, lentils, tofu, nuts, seeds, quinoa, yogurt, including calcium and vitamin D for bone health. That could be dairy or leafy greens, fortified food or supplements. An anti-inflammatory diet can be helpful. Think like Mediterranean, lots of omega-3s, fatty fish, fruits and vegetables, lean protein, nuts, seeds, olive oil and whole grains. It's also really best to limit our processed foods, sugar and excessive alcohol. Hydration is key and is often overlooked. And then thinking about how you personally manage your stress levels and ways to improve your sleep. Optimising sleep hygiene and relaxation techniques like breath work or mindfulness can really help. Have a look at my videos on sleep and the relaxation and mindfulness playlist here on YouTube. The key is to start to build some of these healthy habits into your daily life, making them simple and repeatable and more likely to stick. But if you are struggling, then do reach out for more help and support. I haven't mentioned HRT here, as it's not something that I'm trained in, but lots of women obviously will find it helpful in managing their symptoms. So if the lifestyle changes aren't enough, then do speak to your GP, who will help you to weigh up the pros and cons and discuss the various options available. Thanks for listening. Remember to subscribe to the page to keep up to date with the latest releases and share with someone that you think needs to hear this today. Bye for now.